To talk about our new filler today, and there we go. All right, so we'll start here. Welcome. Happy Monday afternoon, Tuesday afternoon. Yeah, man, I lost track. That's right, I operated today. I'm in scrubs. It must be Tuesday. So today we're going to be talking about new filler. Hello, Jamie. And this filler is called Revanesse Versa. And we're also going to talk about Revanesse Versa Lips, which, surprise, surprise, is for lips. That's the indication for it. I'm going to talk a little bit about fillers in general, for those of you who might not know as much as others, and why this filler is unique and why it's special and why we like it. And we'll show some before and afters and talk about the theory of why fillers are even better than we thought they were a couple of years ago. So that's very exciting stuff. But of course, I always want your questions. So as we go along, please just shoot your questions in. I really am happy to answer almost any question about plastic surgery, because this is not a very long talk today. It's going to be a pretty short one. In fact, we could probably wrap this up in 10 or 15 minutes, which is great, because really, how much do you want to see me talk about anything? So you can see the screen. This is actually right off of RevanesseUSA.com. This is their website. And I was going to make my own PowerPoint, but I thought they did such a good job explaining all the details and questions that we could just kind of scroll through, and I'll just talk a little bit about the highlights. So what makes Revanesse Versa unique? That's the question, of course, highlighted there. There are several things. I think now that I've used it for a few months, I can confidently say that their claim of having less swelling is true. This is a hyaluronic acid filler. So hyaluronic acid is a naturally occurring large sugar molecule in our body. I think of it like a sponge, because it can absorb up to 1,000 times its weight in water. So we want that in our face to keep our skin plump, to keep it moisturized, and basically to add structure. As we get older, our cells, our fibroblasts, which make collagen, and the amount of hyaluronic acid, it decreases, as does collagen production. And so we lose volume, pretty much after our 20s. And we've been looking toward these hyaluronic acid fillers for the last 20 years as a replacement. And they vary in particle size, in viscosity, in the amount they push outwards, called G prime, in the amount of cross-linking, in their amount of dynamics. In other words, how do they move with the patient's natural contours? And they are all similar in that they are absorbable, incredibly well tolerated. Everybody has hyaluronic acid in their body, so you can't really be allergic to something that's in your body. And so they are safe, and they are temporary, and they are also reversible, which, especially for people having a filler for the first time, is something they may want to know, that this filler can be reversed. All of the fillers that I carry, I think, are outstanding, whether they are made by Allergan or Galderma, or from Revanesse or Revanesse or whomever. They're all good. They just each have a little bit of a unique profile, and that's what we kind of pride ourselves in doing, is being the experts, having the best products, and knowing when to use them and where they're best applied for people. So I'm going to kind of tell you what I think is unique and why I like Revanesse so much, and I think you'll agree it's pretty awesome. Okay, so that was the brief introduction into hyaluronic acid fillers. Now, back to Versa, and you see the pretty picture there, the box and the syringe. Looks pretty standard. But one of the things that you might not notice by looking at that syringe is it actually has 20% more than every other manufacturer. So that's really fantastic. So instead of 1 cc, where some of the fillers are actually 0.8 cc's, it's 1.2 cc's, 1.2 milliliters per syringe. So 20% more, which is great because it just goes a little farther. And when it comes to fillers, we always want more. We want more as physicians and injectors. Patients typically want more. But of course, we're cost conscious. I mean, I'm cost conscious. I respect that my patients have budgets that are cost conscious. So I want to be able to give you a better result for the same dollar value, right? I mean, that's just basic economics. And so I applaud Revanesse for overfilling their syringes to 1.2. I think that's just a great strategy. So that's the first thing. You do get 20% more, and yet we charge the same amount per syringe. So it's quite a savings right there. Okay, so that's one nice thing about it. Second thing that we were talking about earlier, I'm going to circle back to, is the less swelling. So as part of the processing, and it's proprietary, essentially the molecules of hyaluronic acid are just more uniform and more smooth, which translates to less inflammation, less irritation to the tissue, less swelling, right? Less edema. And so, I can quote a couple things. First of all, on their webpage, there's one study here that shows that 50% more patients treated with Revanesse noted less swelling, right? So basically, more people saw less swelling, or actually no swelling was reported. And I can corroborate this from my own experience. My patients have definitely seen less swelling, which, of course is important everywhere, but especially with the lips. When we get to the lips, we'll get to that. And certainly some fillers will swell more than others. We usually don't offer those, or if I do, it's because the patient specifically wants that filler. So that's pretty awesome. And then talk about longevity. So most of the hyaluronic fillers in this category, meaning the ones that are indicated for nasolabial creases, they're going to last anywhere in the 9 to 12 month range. And that's basically what Revanesse claims as well. Since I haven't used it up to a year, I can't really tell you exactly, but at least for the past few months, I've seen the same duration. And online, my studies of other physicians using it has also backed that up, that it in fact is going to be in line with the other fillers, 9 to 12 months. So that's great. Let's see. We talked about the overfilling. We talked about the longevity. So let's roll down a little bit. There you go. So in fact, you see the syringe here. This is what it looks like. Now, let's talk about this. I mean, this is what's great about these forums, is that there's just so much to talk about that we would never get bored. Okay, so we see a syringe here, and on the tip we see a needle, obviously. Now, I don't typically use needles for injections, although there's nothing wrong with using needles for injections. When I do nasolabial creases or cheeks, I typically will use a cannula. A cannula looks a lot like that needle, but the end is not sharp and beveled. Instead, it is rounded and has a side port. And to me, in my hands, that will produce less tissue irritation, bleeding, bruising, swelling, and those are all good things. We just want to look good right away with the least amount of potential cosmetic downtime. But there's nothing wrong with having a syringe with a needle. So there you go. There's a picture. Anyway, anybody along the lines have a question, just shoot it my way. You can ask me about pretty much anything, and I will give you a candid answer on the spot. Okay. This, again, is more basic science. This is maybe something you haven't thought about or seen, but this picture right here is going to show you a cross-section of our skin. And on the outside, you're going to see a little wave, a little dip, and that's actually what a wrinkle would look like if magnified enough. That first section here down to the wavy line, that's our epidermis. That's the outside layer of our skin. And then the next layer, including this peach color, is our dermis. And physiologically, we divide the dermis into a superficial and a deep dermis. And this is typically where the majority of the filler is placed. And so you could imagine if we were putting filler in this region, we are pushing upwards, trying to push that fold outwards by volumizing. And that's in large part how we treat individual folds and lines, like, for example, nasolabial creases. There are other ways that we manage them. We always like to get some mid-face structure to get our cheek and our zygomatic arch and our malar bone to have a little more forward projection, which would then lift our nasolabial creases and lower part of our face up. That's more injection aesthetics and technique. This is talking strictly about where the filler goes and how it interacts with the tissues. Another generality would be that a larger particle size filler would want to be placed deeper. This just makes sense. You want those larger particles deeper. They're going to exert a greater effect, but also might be more palpable and less dynamic and smooth. So we wouldn't put those closer to the skin edge. And then our really small, fine particle fillers will get really close, right in that epidermal-dermal junction. And in fact, I'll actually put it sometimes right in the epidermis if I want to get a very fine line. Again, these are sort of advanced techniques, and it's injector dependent, not so much filler dependent. The FDA clears or approves fillers for specific indications, just like they do with all medications. However, it's at the discretion of the physician or injector to use them in any way they think is safe and applicable. So we use fillers, quote unquote, off-label all over the face and body because we know it's safe. It just hasn't been specifically cleared by the FDA or approved by the FDA for that area, but that doesn't mean it isn't applicable. What I'm talking about is I'll use, and I have used, Versa right in these fine lines. Works fantastically well. So it's a very versatile filler. Versa, versatile. I see what they did there. Very clever. That was actually kind of funny and it wasn't planned. So if you like that, just give me like a thumbs up or high five or or tell me it wasn't funny. That's fine too. I mean, my kids tell me all the time that I'm not funny. All right, so now we're going to move on to some before and afters here. Okay. Again, this is their website. These aren't my patients, but this is very typical. So I'm just going to sort of point out. We have a slider here, and you can do this for yourself on the website. It's kind of fun. If you slide it to the right, you're going to see the before, and if you slide the slider to the left, you'll see the after. And so in this patient, it's not dramatic, but it is certainly noticeable. So the white dots down here show where and what was placed in. So 0.3 mLs and 0.35. That's a pretty conservative amount, but this lady is young and she's got a youthful appearance, but she does have some finer lines here and her nasolabial creases are going to be present. So when we slide the slider over, you're going to see she has improvement in those areas. Again, not super exciting because they only put 0.65 total, but for a younger person with minor correction, I think that's a fair representation of what it would look like. Moving down to another patient here, and I'm laughing because she has a different skin type, so her dermal thickness and the way she ages is going to be different than people of different ethnicities. And of course, we know that. So I'm going to slide it over to the right here, and I'm going to point out that she's got some finer lines. This is what I was talking about. This would be one that after I give deeper structure, I would go back and I would inject intradermally once I have applied deeper volume and structure. But she's got a pronounced nasolabial crease with some smile lines and even a little bit of a marionette divot in here. But if we look down here, they put 0.3 and 0.5 and 0.5 and 0.05, sorry. I think they need 0.5, not 0.05. Doesn't matter. So let's slide the slider over and voila. So what they have done is a very reasonable, typical treatment. They've treated mostly in the nasolabial creases, but they didn't get that very fine line specifically. And that's okay, especially for something that's on their website because they have to work within the FDA indications, with the website, of course. But that's I'm just telling you what was done, and I would tell you what I would do. So this is kind of also my critique. And we have 16 people, 17 people say hi to me. I want to give you a shout out online. I want to feel like I'm not, alone. I miss doing these in person. But it's also nice that you can be at home and convenient and ask me questions in real time. And we'll just do like one more of these. So next patient here, very pronounced nasolabial creases. You see we went from modest to slightly more deep and now deeper still. And again, this is just 1 ml that was injected, and if we slide the slider over, that's a pretty profound result. This patient responded really, really well to that 1 syringe of filler. And so there you go. I think at this point, we'll move over and talk a little bit about the product for the lips, which they have titled Lips, which is great. Lips Plus with lidocaine. Okay, so let me just say that all fillers typically nowadays have lidocaine built in. It would be really uncomfortable. It used to be really uncomfortable before we had lidocaine built in to do any of these injections, and now with the lidocaine, it's so much more comfortable. I can just say that as a patient myself. Frankly, I think the filler can be less uncomfortable than even getting injectables like Botox or Dysport. So, yeah, kudos. It's wonderful, right? Okay, so right off the bat, we're going to see again, it's a 1.2 ml syringe, which is great. And it's got lidocaine in it, and it's indicated for submucosal lip augmentation. That's what we do with with all these, right? We're getting it just below the pink part of our lip, the vermilion, the mucosal tissue, but it sits above the muscle of our lips. And in that way we get that volume and it moves naturally. This is one indication where I do use a needle. I don't use a cannula for this. I really need to get in the exact right plane, and I have a little more control, but it certainly has less swelling in my experience than some other fillers. So that's one of the things that we really like about it. Let's talk about when we do lips, how I approach it. So I will put topical numbing cream on. Not every physician does this. Some do, some don't. Not every injector will do this. We put it on. We have a very highly permeable topical anesthetic that is potent and works quickly. Within like 5 minutes, people's lips are pretty numb. So that takes the initial shock of having an injection out of the game, and then once we start to inject, there's lidocaine in there. So really, people just don't complain that much about this, which is great. I'm actually kind of jealous. This is just one thing that I haven't had done. It hasn't really caught on with men, and I don't feel a need to, although I'm kind of jealous. I feel like I'm missing out. I love the way lips look when they're smoothed out and nice. So again, same advantages, less swelling, a little extra volume, and if we don't use it all on the lips, we can certainly use it somewhere else, fine lines, wherever you want. Hey, Janine, thank you so much. I see I finally got somebody else here waving hi and saying hello. Thanks for joining us, Janine. So let me just say, I'm sure that the 15 or 16 people who are watching right now probably know something about having lips enhanced, but the biggest concern that I hear from people outside of the office, so in public, wherever we are, when you talk about filling your lips, this look of fear comes over their face. There's just a pallor that happens. And of course, I know what they're thinking, because every time they think about having your lips filled, they think about having those bee-stung, overly filled, overly swollen lips. Yes, some people have that and want that. But that is not something that we do in my practice. Even if you want it, it's just not something we do. We don't like that aesthetic. What we want is what most patients want, which are beautiful lips, where people look at you and say, oh, what nice lips you have, not would you look at your lips, right? There's a subtle but profound difference there, and that's the way that we do all of our aesthetics here. With very rare exception, only if a patient really wants to look done. We just want you to look your best. We want to enhance your natural anatomy and just make it look beautiful and add balance and symmetry to whatever part of the body we're working on. Lips for the face, eyes for the face, breasts for the body. Right? We want things to just be in balance and beautiful, and we have that ability with filler. And so the way that I respond to people who say, oh, I would never have my lips done, they look terrible, is this. Yeah, you're right. Some people's lips look terrible, and you can notice it, and I can notice it, and everybody can notice badly done lips. But almost no one can notice really well done lips. And since that's the overwhelming majority of injectables that are done, that means that for every one person you see, you're like, wow, I can't stand what their lips look like, there are probably hundreds, maybe even thousands of people who who have had enhancement with soft tissue augmentation, and you have no idea. They just look good. So that's my 2 cents on that. And if you like that explanation and analogy, you can use it. And of course, hit me up with questions. I just, I feel lonely here. Let's look at some pictures. So, obviously on the left we have before, and on the right we have afters. Let me just make some commentary here, okay? Yeah, this is a fantastic result if we look at those top lips, right? This is before, this is after. A couple things, she's got some lip gloss on here, which definitely enhances it, and I try not to do that in my own before and afters because I really want to be, balanced in my before and after. So if you have makeup or lipstick on before, you're going to do it after, and if you don't, I won't. But I'm just pointing that out. But the most important thing I will say about the top set of lips we're looking at is she has really pretty shape to her lips to begin with. Hey, Allison. Awesome. Yeah, goodbye bags. You're right. Okay, back to the lips. She has pretty shape to her lips. She has great shape, great architecture. This upper curvature we call Cupid's bow is very well defined. somebody who has pretty lips to begin with is going to have really pretty lips with the same shape, just enhanced. So it's not possible to take somebody who has pencil thin lips and make these lips in the right. So I'll just tell you that right now. If you try to do that, then you're going to look like a duck. And of course, we don't want you to look like a duck. But you can take very thin lips and add some structure and some shape to them by differentially filling different portions of the lip. You just can't overdo it. And so, of course, you have to just trust our aesthetic judgment, which, I think we know what we're talking about here. Again, really pretty lips here. One of the things I want to point out that people may not recognize, but we'll use the top set again. The natural balance between the upper and lower lips is not 50-50 in terms of volume. The lower lips should be more like 65 or 70% of the overall surface area volume. And so I will hardly ever just do the upper lip or the lower lip. Again, it's all about balance. You can see it before and you can see it after. We really want that lower lip to protrude and pout, just as the upper lip is a little bit more volumized. So there you go. All right, let's see. Okay, here's a good example. So this lady does not have a well-defined Cupid's bow, right? These pillars right here, which are called philtral columns in this little valley, not well-defined. So this is a really profound result because she has gone from thinner lips with poor shape to fuller lips with great shape. So kudos to the injector who did this. I think this is fantastic. This is what I strive to do when I do lips, and there you go. There's my aesthetic opinion on that. Same thing down here. Personally, I think the lower lip is I think they're both slightly overdone on this lower picture here. Again, it's a matter of opinion. I don't think they look crazy. I just think they look done. So if it were me and this patient left it to my aesthetic discretion, I would not have filled it quite this much. But that's not to say that they're bad looking. I think they're just slightly unnatural looking. But if a patient came in and wanted that look, I wouldn't fight them on it, because some people want that look and it doesn't look freaky. It just looks a little bit unnatural. But that's a good example for you to understand. So that kind of covers the two new fillers, and I'm going to wrap it up here. And I have a little document here that comes off of realself.com, and I thought it was first of all, realself.com is a great site for information about procedures and products in cosmetics and plastic surgery. So pros and cons of Revanesse. So again, number one, the pro is that there is less swelling. Again, in this clinical trial, and they're saying it's funded by the manufacturer, 50% fewer patients experience swelling than people with a different filler. But knowing how it's produced, knowing the manufacturing process, understanding that on a molecular level, it makes sense to me that it would be less inflammatory, and that's been my experience too. So yes, I can say I agree that there's less inflammation with it. Results are apparent immediately and last up to a year. Sure, I mean, any soft tissue filler for the most part, with the exception of some non-hyaluronic acid fillers, but all the HA fillers, you'll see an immediate result, and yes, it lasts up to a year. Depends where you put it. In high motion areas like the lips, it's not going to last that long, 6 to 9 months maybe. Lower areas of motion, yeah, it can last longer. It's the only filler in the US that's available in a 1.2 ml syringe. That gives you 20% more product per syringe, and it's the same price. So right there, that's a nice discount. And this is the cool one, and I'm really happy that RealSelf put this in here. So we're going to talk about this. This is my last kind of cool talking point. Dr. Lindsay, yes! Do you achieve that result by adding filler to the philtral columns or just a Cupid's bow? I'll circle back to that, Lindsay. It's a great question, and I'll answer that. So it says, in addition to adding volume, HA-based fillers help to stimulate new collagen growth, helping aging skin look and act younger. So just think about that. In addition just to adding volume, they actually stimulate your body to make more collagen. This is a relatively new discovery in plastic surgery. Here's how that happens. Our cells that produce collagen, which is it's the protein that gives structure to our tissues, they're called fibroblasts. And as fibroblasts age, as we age, They're basically like a big rice grain or a vermicelli or something. It has a shape like this, and as we age, it will tend to shrink and flatten. And as it flattens, it ceases to produce as much collagen. When we add hyaluronic acid to the tissues, it will literally deform the fibroblasts and stretch them back out to their more juvenile form. And just by forcing them into that different shape, we found that they start to produce collagen much like they did when they were younger. So function in this case follows form, and just augmenting our tissues with hyaluronic acid will make our tissue younger more permanently, because collagen is not a temporary filler. It's our own substance of our tissue. So, and this is not particular to Revanesse. No knock against Revanesse, just that any hyaluronic acid filler will have this effect. So it's very exciting. We've all noticed it in the field when we look at our patients who have had fillers for 10 and now 20 years. They will look younger than age-matched counterparts who have not had filler, despite the fact that by duration, all the filler should have been out of their face. They've come back a year later or 2 years later, let's say, and we know all the filler's gone, but they still look better and younger than they otherwise should, and this is the reason that we suspect. So very exciting. On to the cons. Hey, Dottie, how are ya? All my friends, awesome. Dottie, if you're just joining, circle back at the end. It'll be on Facebook and watch it, because we had some good stuff we talked about. Cons. So yeah, all HA fillers are temporary. You know, it's in the con category, but I don't really consider it a con. Yes, there are longer lasting fillers, it says in there, like Bellafill and Radiesse and Sculptra, and we offer all of those, and they have a place. But there is a place for temporary fillers. Not everybody wants a filler that's going to last forever. Why? Well, as our face ages, so does the shape, and you might not want filler at one point where it was before. And also, it's not reversible, and sometimes people just don't want something permanent in their face. So there you go. Availability in the U.S. is limited. Only Revanesse Versa and Lips are approved by the FDA. Yeah, there are other fillers. It's a Canadian company. There are other fillers in the Revanesse portfolio, which I'm sure will become available soon enough. But it's limited in the U.S., but it's not limited here because we have it. And then allergic reaction risk is low. Sure, that's with any injectable filler, although I don't think I've ever seen an allergic reaction with a hyaluronic acid filler. I can confidently say I've never seen one. So there's that. Before we finish, I'm going to circle back to Dr. Lindsay's question about philtral columns. Okay, so great. Okay, love this question. Let me find a picture of somebody to show you where they might have done that. I'm not sure they did it for any of these patients, Lindsay, but let me just tell you how I would approach it. And this is definitely a individual technique kind of thing. All right. When I'm trying to enhance this Cupid's bow look, I do 2 to 3 things, and it's different for different patients. Number one, yes, I will put some additional volume directly under the apex of this ridge here, right, of that philtral ridge. So I'll put a little bit under there and a little bit under there, but deep, under the mucosa. That will certainly perk this up and stand it up. But if you put too much in there, here's what happens, and I don't like it. You'll see it in this patient here. It everts or rolls that upper lip up, and then you wind up with sort of this fold or crease in the upper lip, which just looks unnatural. I really don't like it. And so in order to avoid that look, then I will actually add filler right into the philtral column. And for those of you that don't know, these 2 ridges that kind of come right down below our nostrils, those are what we're referring to as philtral columns. And they give our upper lip a shape, as opposed to this bow, which is the Cupid's bow. So to answer your question, for almost all of my personal lip enhancements, I will put some volume right under the ridge of Cupid's bow to pick it up. And if it looks perfect like that, or if somebody has a really pronounced philtral column, I don't fill the column. Like this lady here, you can see has a really pronounced philtral column. I might not put any, or at least as much, but I just love the look. I don't overdo it. I just put a tiny little bit, like maybe 0.05 or maybe 0.1 in there. And this is the last little tip and trick. As I inject retrograde, so I come up here and I inject back, and then when I get right to that vermilion border, I'll put just a tiny bit extra to pick it up. I'm not a big fan of highlighting that vermilion border. Some people will go right in and inject right in there. I find it does work well for older patients who need a little definition between the pink vermilion and the regular skin color. But for almost everybody else, I think it looks unnatural. So hope that answered your question, and we can talk offline more about it, because I love talking about this stuff. And Margaret, first of all, hello and welcome, and thank you for being here. Would you recommend this new Revanesse for a mid-cheek groove since it lasts so long, or does it look great mainly on lips? Mid-cheek groove, I'm not 100% sure what you're referring to with that, but I will tell you that I think this is a very, very versatile filler. The only places that I wouldn't reach for it would be if I'm trying to build the cheek mass up. I would just go with a larger, more robust filler. Your Lift, your Voluma, your Ultra Pluses. So I wouldn't necessarily use it there, but pretty much anywhere else where there's a fold, I think it's indicated. So. All right, so what I said I was going to talk for 10 minutes, and that was 34. That's typical me, just going on and on forever, but I am passionate about this stuff. I love educating. I love just teaching you all the things that I know so that you understand how things are done and that they can be done safely and beautifully, and this is Revanesse. Now, we always have a special. So what would this Facebook Live be without a special and a call to action, right? You waited patiently for 34 minutes listening to me talk. So as always, we are going to have a discount, and I believe you have to call by April 14th. And in addition to the awesomeness that you get 20% more with every syringe, you're also going to get 20% off. And I can just tell you right now that our introductory price is $600 for a syringe of the filler. And that's in line with most of our other fillers, which after doing a little internet research, I think we're kind of on the low end of pricing. So we're going to have to figure that out. But not for you right now. And on top of that, there's 20% off. And so I'll do the math for you. That's $120 off. So that's $480. I can't even buy my kids shoes for that price. So come on in and take advantage of that. And we're always so happy to extend these specials to you guys because you're so loyal, and we love our patients. So there you go. You cannot do better than that. Misty, hello Misty. First of all, hello. Are areas numbed prior to injection? Yeah, the lips are numbed with topical. All of the fillers have lidocaine built in. So typically we don't numb, nasolabial creases or cheeks or things like that. If you ask the injectors nicely, they'll probably put a little numbing cream on if you so desire, but most people don't really require it except for the lips. We would definitely want to topically numb the lips. Hope that helps you. Hey Deb, you're welcome. Great to see you. All right, everybody, I hope you found this interesting and informative, and this is the conclusion of our talk on Revanesse Versa and Revanesse Lips. All right, have a great day. Bye, everybody.